between Medicare Advantage and Medicare Supplement. And then, so that should take about 15 or 20 minutes or so. And we're going to talk about the future of those programs, what's possibly best for you. And after, we're going to open it up to the floor as usual, and we'll do a live Q&A. So this is live. If you're watching this live, go ahead and put your questions in the chat. And once I talk about the different Medicare options, we'll answer all your questions. If you're watching this on a recording, then make sure you subscribe and like, and that way you can join our next one if you have any questions about all things retirement, disability, survivor benefits, and all the rest of it. Okay, so my name is Ed Weir. I'm former manager of the Social Security Administration. And let me show you, a lot of people, visual learners, there's much debate whether there is such thing as visual learners, but I found a nice little chart that kind of, that was let me go ahead and pop this up here real quick. So this is kind of the differences, very simplified, between Medicare supplement plans and Medicare Advantage plans. People often ask me, what's the difference between the two? So, obviously you have to have the original Medicare, original Part A and Part B, in order to get either one of these. And then, but the problem with Part A and Part B is they have so many different gaps. The big one is the Part B 20% co-insurance, where if you have $100,000 surgery, you have to pay $20,000 of that. So what people do is they either get a Medicare supplement or a Medicare Advantage plan. As you can see, the Medicare supplement, pretty much just one switch. You turn it on and off. And it's super, super easy. A Medicare Advantage, a lot of switches, a lot of dials, a lot of things to adjust, a lot of things to keep an eye on. So we're going to talk about all of that today. And as in anything in life, if it's super, super easy, it takes, a lot less effort. It usually, costs some money, but we'll talk about that. Medicare Advantage plans, you got a lot of plans out there that are zero premium, and Medicare supplements, you do have to pay a monthly premium. But a lot of people would argue that the monthly premium in the long run is actually cheaper than a zero premium plan. And we'll talk about that. Okay, so co-pays, co-insurance, deductibles, MOOP, all the rest of it. With a Medicare supplement plan, those are predominantly like the G or the N. Those are the two big plans out there. There used to be a Plan F, but really can't buy that anymore. Even if you could, you probably wouldn't, because it's so expensive. So with those, like particularly the easiest one to understand is a Plan G. And I've got a video. I'm not going to go into the details of Plan G versus Plan N, because I did a video on that 4 or 5 days ago. So just look for that. It'll tell you all the differences. But overall, Medicare supplement, I'll just throw out Plan G. You get that, and you have a deductible $240 a year this year in 2024. And that's pretty much it. You still have to pay your Part B, regardless if you get a Medicare supplement or Medicare Advantage, whatever the case may be. You still have to pay your Part B premium, which is the $174.70. But if you get a Plan G, if you have $1 million surgery or something, or you get a $100,000 Band-Aid in the hospital, you pay $240 and you're done. Done. That's why it's just one switch. The Medicare supplement plans don't come with all the other stuff you see. It doesn't come with dental, doesn't come with vision. You have to get a separate Part D prescription drug plan. Doesn't come with that. Some of the drugs are covered if it's like an in-office infusion or something like that. That's covered under a B. So with a Medicare supplement, you keep your original A and B, and there's no networks. That's the big thing. That is the big thing that everybody likes about the Medicare supplements. They're easy to understand, no surprises. You just pay the monthly premium, $240, if you get a Plan G, and you're done. There's no pre-authorizations, no networks. I always say, people ask, what's the network that's this? Well, America. Pretty much every doctor in the country, hospital, clinic that takes Medicare, accepts your plan. If they accept Medicare, then your plan is good, Plan G or Plan N. And you don't have to get any prior authorizations. People ask, what about the customer service on this company? I'm saying, doesn't matter. You never have to deal with them. It's like, yeah, you'll never deal with the insurance company. You go to your doctor says you need X, Y, or Z. If that's something covered by Medicare, then the doctor does it. You and your doctor decide, doctor does it. They bill Medicare. Medicare, for instance, pays the 80%, and then the other, the insurance company pays the other 20%. You never have to get involved. You never have to ask insurance company at all. Okay, so that's a very simplified explanation of Medicare supplements. Medicare Advantage plans are different. So those co-pays, co-insurance, pay as you go. So a lot of people look at the, the shiny part of it. Oh, zero premium. Oh, gym membership. Oh, dental, vision, and they look at that, but they, a health insurance plan is for health insurance, not for gym membership. I'm sure those are nice, but it's a pay-as-you-go type system. Even if it's zero premium, if you go to the hospital, you might have to pay $100 a month, $200, or excuse me, a day, $100 a day, $200, $300 a day. If you get an MRI, you might have to pay a copay of $50, $100. If you get this, you might have to do this. You might go to a specialist, you have to pay a copay, have to get co-insurance on this. And so there are, it's called the max out of pocket. The government, Medicare, limits the maximum out of pocket that a person can pay on a particular plan. This year, the max out of pocket is, they call it the MOOP, is $8,850. That is if you stay within the network. Again, that's one of the problems with the Medicare Advantage people have issues with, is they sign up for it because their doctor, because there are networks, so you have to make sure whenever you pick a Medicare Advantage plan, you have to pick one that accepts your doctors. But the problem is that network is always changing, negotiations, and even if you call up your doctor and say, hey, do you take XYZ Medicare plan? And they say, oh yeah, the person at the front desk, yeah, we take XYZ Medicare plan. And then they go into, they say, oh, we don't take this version of XYZ Medicare plan, that company XYZ, because each company has 5, 6, 7, 8 different plans, and they might take one version of the plan but not the other version. So if you ever call up and say, hey, I'm thinking about sign up for this Medicare Advantage plan, do you take it? Never say that, because it doesn't matter. Tell them specifically the plan number. Again, your company probably has 5 or 6 different plans, and they update them every year. We'll talk about that in a little bit. So you don't want any surprises. So the networks are always changing. Even if they say, yes, okay, we take XYZ Medicare Advantage plan, and we take that specific plan, 104034 or whatever. And then a month later or 2 months later, you go down there, and now the doctor is no longer a network because they can get paid enough, or got tired of getting that particular insurance, or they don't have enough people with that insurance. They decided not to do the paperwork to update it. So those networks are always changing. And the decision to get your medical care is not between you and your doctor. Now it's between you and your doctor and the insurance company. So the insurance company, you've probably heard this, doctor says, okay, you really need to do X, Y, or Z. Okay, let's do it. Okay, let's see if the insurance company will pay it. And the insurance company hopefully will come back, but they might come back and say, okay, we'll try this other thing first, or yeah, give us some more paperwork, and or they deny it right out. So you're essentially, with a Medicare Advantage, you're giving up original Medicare, and you're getting your health insurance from that particular company. And why do people do that? It's as you can see in some of my other videos, I believe that everybody should get a Medicare supplement plan, but it's a matter of budget. Well, I believe personally, Medicare should get rid of all those. And like, for instance, if Medicare, the Part B covers 80%, why just 80%? You paid FICA taxes for decades for that. Why doesn't it just cover 80%? Why do they have gaps at all? Should have no gaps, and should have no insurance companies involved. But that's just my opinion. And one day when I become the dictator, that'll be the second thing I do after the cure for male pattern baldness. But yeah, so that is the issues with Medicare Advantage, the pre-authorizations, and the networks that are always changing, and kind of the pay-as-you-go system. So, but it comes down to money. If if you get a zero premium plan and you live the next 50 years and you never really get sick, Medicare Advantage, 100%, that was the way you should have went. However, life is what happens while we're making other plans, right? If you get sick, then a Medicare Advantage just might cost you more in the long run than actually paying a monthly premium. And not to, mention the delays in authorizations and the denials of authorizations and all the rest of it. All right. So, what kind of issues do we have going forward here? Um, here's something you need to decide. Not only now, if your budget only allows a Medicare Advantage plan, then great. Everybody wishes it was different, but it's not. And the reality is, you just can't afford any more in your monthly budget. That's why in the thumbnail for this video, it's got that little box with 1,000 different little dials and buttons and stuff like that. So you just have to be more diligent and keep up on this thing on a regular basis and fight for pre-authorizations. If you're denied, you fight for it, all the rest of it. So it takes a lot more effort when you have a Medicare Advantage plan. But if you put in that effort, then the results should be good. But I also want, if you're on the fence on either one of these and says, well, I could possibly do a Medicare supplement, but it's going to be tough. And that zero premiums, wow, it's really nice. And gym membership and, bells and whistles and all the rest of it. But the future, because was it 51%? So a majority of people on Medicare have Medicare Advantage plans, and that's 30 million people. It's increased quite a bit because people love those zero premium plans. But the future of this is this year, if you watch the news, you see a lot of these Medicare insurance companies that are kind of they're anticipating going out of particular areas. If you're in a major city, you should be good going forward, but it looks as though, you just watch the news, a lot of these Medicare Advantage plans are saying, okay, this is an unprofitable area, because the government has announced that they're going to reduce the payouts to these Medicare Advantage plans. Because how this works is, how do they get their money? Zero premium, how do they get their money? All that money you paid into FICA all those decades, that money is sitting in Washington somewhere. And when you sign up for Medicare Advantage X, Y, or Z company, that company goes to Washington and says, hey, all that money Jane put into FICA for the last, 40 years, give us some of that money every month and we'll take care of her health care. And that's kind of been the deal for the last couple of decades. So that company gets your money, and that's your money. So watch my video on how to get your money back, because that is your money. In terms of getting it back in terms of your health care and preemptive screenings and everything like that. So that is your money. So they get that money, and that money is being reduced. The government has announced they're going to reduce a little bit, and these companies, they're in it for a profit. So they're going to start cutting in other places. So the future, if you live outside of a major city, you really, really need to pay attention, because you might be getting a letter that says, okay, we've pulled out of your market. We're no longer going to service you, so you need to look for somewhere else. There's some places out in the country, way out in the desert, and out west, that don't even have Medicare Advantage plans because it's just not profitable enough. So those people are kind of stuck with either nothing, or there are some really, really terrible plans out there that have nothing. And that have so many copays and co-insurance, it seems. But places like Florida have really, really good Medicare Advantage plans because there's so much competition. So if you live outside of a major city, you definitely need to stay on top of this. And across the board, one of the other things that's happened with the Inflation Reduction Act is prescription drugs. There was a catastrophic that the max you could pay for your drugs, was $8,000. Next year, that's going to change to $2,000. So insurance companies, again, they're in it for a profit. That CEO needs a new yacht. they they have to take that hit. So they are not going to take that hit. They're going to pass it on, right? So they're getting less from the government. They're having to pay out more for drugs and stuff like that. The government itself is, the reason they started these Medicare Advantage plans is because they thought, they would control ration care. They don't want to do it, so they're going to farm out the rationing of care to private companies, make them, I guess, kind of the bad guy, profit driven. So the companies have done that, and they're rationing the care, with pre-authorizations and denials and all that kind of stuff. But it turns out that these Medicare Advantage plans actually cost the government more than if those people were on original Medicare. So the entire intent of the of the program was to save the government money, but it's actually costing the government money. So that's why they're starting to reduce the money they pay to these companies. And again, these companies are gonna, pass that, hurt onto everybody else. So we've got a kind of a perfect storm coming up is the solvency, the costs, the reduced payments, that Part D thing thrown in there, the pre-authorizations, and a lot of complaints about that, people being denied left and right. So the future, I'm everybody in the industry is worried about. There's 51% people in Medicare Advantage. So are we in the period where everybody gets kind of lulled into these plans, and then they can't change later? Because the problem with Medicare supplement plans is that if you're not 65, around 65, a few months before, a few months after, or you're not new to Part B of Medicare, you just got you're 70 years old, but you've been working and you just got your Part B Medicare. For those people, and there's a few other very, very small limitations, for those people, they can get a Medicare supplement. If you're healthy, you can probably get a Medicare supplement. Other than that, you can't. So if you get into the zero premium plan because you like the zero premium and the bells and whistles, and then 5 years later you actually get sick and you lose this, that, and the other, you get charged this and extra charges here and charges there, and you're like, well, I guess I should have done a Medicare supplement. I think I'll just go ahead and get a Medicare supplement. Well, you might not be able to get it because Medicare supplements the only insurance out there that can discriminate against you. Obamacare, the Affordable Care Act, can't take pre-existing conditions. Doesn't matter if you're healthy or not. You have to have it. They have to give it to you. Medicare Advantage, they have to give it to you. Original Medicare Part A, they have to give it to you. So, but a Medicare supplement can say, "Oh, you're not healthy for us. You've got this, that, heart issues, or diabetes, or whatever the case may be. So we're not going to take you. So you're going to be stuck with a Medicare Advantage for the rest of your life." So that's, I'm just kind of looking to the future here. I'm hoping I'm not going to be on here 5 or 10 years from now, and everybody's going to be saying, I got sucked into the zero premium plan, and now it's no longer zero premium, and they're nickel and diming me to death, and they're denying this and denying that. I should have got a Medicare supplement when I could have. Again, if it's in your budget, please. But if it's not, then you just have to keep up on it. And one of the ways you keep up on it is every year, the government mandates Medicare Advantage companies send you what's called the ANOC, the Annual Notice of Change. So you'll get that in September. It'll tell you about all the changes for the next year. So for this one, it'll tell you all the changes for 2025. So don't just pay attention to, okay, it's, people open that up and they say, okay, it's still zero premium. It still covers my doctor. I'm good. What kind of cat videos out there? You can't just do that because they don't usually change those. They change the networks, but the zero premium and the little bells and whistles, you really want to focus on the important stuff. Okay, last year, if I went to the hospital, I had to pay $20 a day. Well, now I have to pay $200 a day. Oh my gosh! If last year I had to pay $10 for an MRI or a CAT scan, next year I have to pay $300. So those are the things you need to focus on. And if you have a Medicare insurance agent that helps you, make sure you go through that with a fine tooth comb. If you don't have anybody you trust, that's why I put together a network of Medicare insurance agents that I've kind of vetted and know and trust throughout the country that can help you out nationwide. So give us a call, and that's always a free service. So and so if you want us to help you with that, just email me or let me put my info up there. Just email me or give me a call and say, Ed, put me on the list for October, because the new plans will come out in October for 2025. So just email me and say, hey, Ed, here's my name. Here's where I live. Put me on the list for October, and then call me back then when the new plans come out. And then we'll have somebody call you up and say, okay, here's what you got, and here's how it's going to change next year. And here's some other options. And that's a completely free service. All right. So you definitely need to keep up on it. All right. I think that is good. If you're just here for that part of the presentation, then have a beautiful day. But if you're here with particular questions and all things Social Security, retirement, disability, Medicare, Medicaid, survivor benefits, spouse benefits, and all that, just stick around, ask your question. And obviously, always make sure you subscribe and like, so this information goes out to more people. Okay, let's see. All right, so I couldn't see the chart. Oh, then never mind. Okay, could see the chart. All right. Megan, hello, Dr. Ed. Thank you for all you do for all of us. You're welcome. You're welcome. All right, let's see here. Calgal. A 70-year-old friend is on SSDI, SSI, and works part-time. Social Security is still reducing her SSI based on her job income, which is $120. Are they supposed to do that at age 70? Yeah, they'll do that forever. SSI is a welfare-based program, so any other type of income or resources coming in, they hold that against you in terms of SSI, not SSDI. So she has SSDI and SSI. That means her SSDI, her disability insurance, isn't, it's small. The most you can get on SSI this year is $943. So people can get on, SSDI. She paid in, but she didn't, she paid FICA all throughout her life, but she doesn't, it wasn't very much. So let's say she only receives $500 from SSDI. And then only $500, what they do is they give her part SSI to kind of make up the difference. So that $943. So they're holding that $120 against her SSI benefit. So yeah, unfortunately, they're going to do that forever. Carol, what's up, Carol? Plan G also offers medical coverage for travel out of the U.S. Yes, yeah, a lot of the limited, for extended periods of time. I did a video on this about living out of the United States, and yeah, it doesn't cover forever, but like in emergency type situations, you can get healthcare emergency type coverage while you're outside of the United States. So if you travel often throughout the country, again, what's your network? America. So if you travel around the country a bit, Medicare supplement is definitely probably the way to go. Again, it's all budget. Yeah, if you can't afford it, you can't afford it, then you just have to do a Medicare Advantage. And there's a lot of, YouTubers and TikTokers out there that harass people for getting a Medicare Advantage. And, my response is, okay, I'm sure the people are like, if you're willing to pay their Medicare supplement premium, and the premium for like a G or an N, if you watch my videos, I like N a little bit better. It's a little more difficult to understand, but it's cheaper per month. Usually about $20, $30, $40 cheaper per month. The plan G could cost anywhere from average $100, $125 or so. If you're like in New York, it's like 2 or 3 times more. And again, average throughout the country. Yeah, I mean, if you're complaining about people getting Medicare Advantage, people in the comments all the time, oh, why you, Medicare, you're dumb to do a Medicare Advantage. Okay, buddy, pay this person's supplement, and there you go. Or yeah, so Savannah, there was a study done that showed that one hospital stay with the Medicare Advantage plan would cost more than the monthly premiums for a supplement. Yes. I'm only an MA plan because I'm on SSDI. Yes. 2 good points, Savannah. Thank you. Yeah, again, it's zero premium, until you need it. And then you have to pay this and pay this other thing and pay this other thing. And again, as I said, if you get a zero premium and live the next 100 years without being sick, then Medicare Advantage was 100% the best decision. But if you get sick, then, and for people on SSDI, it's even worse because these are all state regulations. I wish it was a national thing on because insurance is regulated by the states, and so the states tell the insurance companies whether they have to offer Medicare supplements to people. So Savannah lives in a state, it sounds like, that the state doesn't require the insurance companies to offer Medicare supplements to people under 65 because the insurance companies don't want to offer Medicare supplement plans to people under 65 because those people are on disability. That's why they got Medicare under 65, and therefore it's going to cost the company money. And all these companies, the same companies do Medicare supplement plans also do Medicare Advantage plans. So you say, oh, this is a terrible company, they do Medicare Advantage plan. Well, they probably do Medicare supplements too. So yeah, and some states said, okay, you have to, insurance companies, you have to offer Medicare supplement plans to people under 65, but they don't regulate the price. So like in New York or different places, they regulate both of those. But that's why it's a lot of other regulations. That's why it's kind of expensive there, which is good. I think, yeah, the entire country should offer should do New York type regulations. And then that would bring the price down for everybody, because the problem is everybody moves to New York when they actually get sick because they can't be discriminated against. So anyway, but yeah, so Savannah's obviously, she doesn't have that option. Sounds like she would like to get one, but she doesn't have that option in her particular state. However, when she turns 65, she can get. So once you turn 65, you're in a different window. You're in the 65 window. So anybody that you know on disability, once they turn 65, they can get any plan they want, and they're not discriminated against. There's no pre-authorizations or health screening or anything like that. So they are good to go. Yeah, so okay, yep. So she was in Michigan, and it will cost her many times more as when they turn 65. Yes, exactly. So Michigan, it sounds like they offer it in Michigan. The state mandates the insurance companies to offer plans, but they don't take the next step and say you can't charge people more than people that are 65. Warrior, aside from your monthly Social Security, how much can I make a year if I work? I'm 65. Yeah, your monthly Social Security doesn't count in there any type of unearned income. So you're talking about the annual earnings limit for Social Security. It's $22,320 this year. So anything over that, Social Security holds back $1 for every $2 you go over. So again, that doesn't count your Social Security. That doesn't count any pensions you have or 401k disbursements or anything like that. All right, Donna. I have read a lot of horror stories about Advantage plans with the insurance companies committing fraud, billing for things they did not do, and denying patients care. Yeah, you see a lot of that in the news. I mean, that goes with not only Medicare Advantage, but other, employer-based plans as well. But a lot of, that upbilling, and you went in there for this, and they, add this other thing, and yeah, there's unfortunately a lot of fraud out there. Good evening. When a person gets SSI, will having their income tax in the account be counted against them? Yeah, if you get any type of income, yeah, when you get SSI, again, that's a welfare needs-based program. If you get any other type of income coming in, then they can definitely, it depends on the nature of it and everything. And, whether you spend it down, there's a spend down thing. You says, well, I'm getting my, income tax check back. Sure, it's a, $1,000 or $2,000 or $3,000, but I'm going to immediately spend it. My car broke down. I need to buy a new car. I need to buy a new, water heater, or whatever the case may be. And then, yeah, just make sure you contact your SSI claim specialist at your local Social Security office. Let's see, Don Ricky, can you be denied Medicare G, and was a 240-year max yearly payout? Yeah. Yes, you can be denied a Medicare supplement plan G. You cannot be denied when you turn 65, and you can't not be denied if you're new to Medicare. And there's a few other, if you move to a new area, it seems, yeah. If you want to kick around whether you can switch to a G or an N, make sure give me a call or email me, and I'll have one of my network agents give you a call and check out all your options. But yeah, $240 is your max yearly payout. Again, you still pay the Part B premium, $174.70. You pay the Medicare supplement plan G, whatever that is, monthly. But if you have $1 million surgery, whatever, you pay $240. Yeah, if you've been around for a while, during these lives, people say, "Yeah, I had this, the cancer, and I had all this, and it cost, $400,000, but I paid $240." And so, and again, no pre-authorizations, no, stage 4 cancer, and the insurance company comes back and say, "Well, have you tried to walk it off?" It's old Marine Corps thing, always walk it off. Yeah, if your doctor says you need it and you want it, you're done. Again, you don't have to ask the insurance company. So, Freddie, hi Ed, I'm 64. I want to retire when I'm 70. My wife and I drive a tractor to semi, and she'll be 60, 60, 30. She will see me able to draw at 63. Can we both retire? Yeah, my dad was a long distance truck driver as well. Drove an 18-wheeler for about 50 years. So that's yeah, that's one of those things you gotta, yeah, you can't work. It's hard on your body. So yeah, so if you wait until you're 70, you're going to get delayed retirement credits. Those are 8% per year every year after your full retirement age. So if your full retirement age is 67, 8%, that's 24%. So, if you get $1,000, that's extra $240. And when your wife turns 62, she can go ahead and start getting her benefits as well. So if you're going to be the higher wage earner, so I did a video on this a few days ago. It's called the split strategy. So make sure you watch that video. And again, all the videos I've been doing for the last month or so, people look at it and say, "Oh my God, it's an hour long. I don't have an hour long." The topic part is either 5, 10, 15, 20 minutes, but then I do like this. I answer questions for another hour. But watch that video on the split strategy, and it might pay for your wife to go ahead and start benefits early, or the low income wage earners start their benefits early, and then you wait, and then once you file, then she files on you. So, all right. Do you think Plan N is the best if you rarely go to the doctor? Yeah. I again, Plan N is right there, and Plan G is, half a millimeter down. I like N because I'm just naturally cheap like that, and I like to save money every single month. So the difference between a G and an N, again, I go over detail, is excess charges, which, most doctors accept Medicare, so there are no excess charges. With a Plan N, you could pay up to $20 when you go see kind of a diagnostic, doctor. Usually it's about $14, but you save that much every month. So yeah, watch my video on the difference between N and G, but I prefer N myself. But a G is just as fine, just as fine. So yeah, Savannah, I can get a supplement in Michigan, but it costs too much. Yeah, they really need to do something about that. Cheryl, supplement plans cover skilled nursing homes or Alzheimer facilities. Yeah, this is so supplement covers whatever Medicare covers. So, and Medicare, unfortunately, skilled nursing facilities. So if you go, yeah, I need to do a longer video on this and kind of break out the differences. Medicare, original Medicare pays for hospice, and because original Medicare pays for it, then Medicare supplement picks up the remainder. But in terms of nursing home long term, yeah, none of it really does. It pays for skilled nursing facilities, and people mistake that. A skilled nursing facility is if you go and have an operation, and then you need some type of skilled nursing facility for a week or 2 weeks or 3 weeks after. Then original Medicare covers that, and if original Medicare covers it, then Medicare supplements cover it. So yeah, it covers that. But in terms of long time nursing, no. That's why, people that are, rich, they just go get a, $100,000 a month, nursing home when they get old. Um, but if you're low income, Medicaid pays for it. You can get the state Medicaid offices to pay for it. But if you're middle of the road, then if you've got assets, then you've got to put it out. You've got to pay all that. I was just talking to somebody yesterday, and they were paying what, $15,000 a month for their long term for their parents. So 15,000 a week or 15,000. It was a crazy amount, but yeah. And then, but once you use all your income resources, then you can apply for Medicaid. And what people say, well, I don't want them to take my house. They won't take your house when you're alive, but when you pass, they can take your house. The Medicaid office can take your house. And you thought you were going to give it to your kids or something, but yeah, Medicaid takes it to pay for the bills. Um, so that's why some people put their house in an irrevocable trust, and you have to do that 5 years before you're going into a nursing home. So, all right, let me ask them. Let me get some TikTok questions here. TikTok, please subscribe and all that kind of stuff, and then come over to my YouTube. TikTok doesn't like me because I talk about money, Social Security money, and I talk about people passing away, dying, and TikTok doesn't like either of those. So I'm not popular on TikTok. Um, they don't like me. I turned 65 in July and on disability and survivors. What plan would be for me? Oh, okay. Yeah. If you can afford it, I 100% recommend Medicare supplement. And if you're on disability, that means you probably, use your, you probably use, healthcare more than normal. So for you, I would do a plan G. If you're gonna afford the extra 10, 15, 20, $30 a month, depending on your particular area. Yeah, and let's see, in July, so you need to start doing something now. You need to start figuring out something now. So if you have a Medicare insurance agent that you know and trust, give them a call and tell them to go over your options. If you don't, give me a call. For TikTok, it's on the front page of the TikTok thing. It's got my phone number and email me your name, phone number, state you're in, because they're all state specific, and tell me what you need, and say, hey, I'm going to be getting my I'm going to be 65 in July. I want to check out all my options, and I'll have someone give you a call and give you all your options, and that is 100% free. My husband and I get SSDI. He recently passed, and I'm getting 40% of his. Oh, wow, sorry to hear that. All right, yeah, so up 40% of his. So yeah, the calculations are, and it depends on your age. Sounds like you might have filed for reduced benefits on his record, and so you're receiving the survivor benefits. And how it goes, you receive up to X amount of up to 100%. It's reduced if you file early and your age and everything like that, and then it's minus your own. So it sounds like, say for instance, his benefit was 1,000 and you're already getting $600 on your own, then they give you the difference. That's why they're giving you that 40% is the difference. So wow, I'm terminal. Wow, 65, but have employer health care through June 26. So do I? Yeah, yes. Wow, sorry to hear that. Yeah, once you lose, if you have health insurance from work, current work, yours or your spouse's, you can continue to receive that. You don't have to sign up for Medicare. But if you're going to be losing health insurance from current work, yours or your spouse's, then yeah, you have to sign up for Medicare or you'll be penalized. So yeah, if you're going to be 65 in June and it looks like you're going to lose your health insurance, then yeah, give us a call, email me, and we'll find someone to to reach out to you and give you all your options. But yeah, Medicare supplement sounds like 100% the way to go for you, so you're not nickel and dimed and all that. Let's see. I am on SSDI at 61. Supplement is $95. Wow. Okay. Wow. Good deal. So your state contact your state representatives, your governor, and all that kind of stuff, and tell them you live in one of the awesome states. So good deal. So that means your state has done two things. They said, insurance companies, you're making tons of money. Don't discriminate against people with pre-existing conditions that are not healthy, that are on disability. Give them. And number two, insurance companies, you guys make trillions of dollars. Don't charge these our people extra money just because they're on disability. So good job on your state. Oh, Oklahoma. Oh, okay. It's Oklahoma. $95 for a supplement on SSDI. Oklahoma. Oh, okay. All right. So I'm gonna have to stop harassing Oklahoma. Um, I went to high school in Paris, Texas, just right across the Red River, and I lived in a dry county. And at 16 years old, 17 years old, we had to go to Oklahoma to get alcohol. So thank you for ruining my my teenage years, or making my teenage years awesome, Oklahoma. And you're making people's life awesome by regulating the insurance company. So good deal twice on Oklahoma. Great job. Yeah, half of my teachers are University of Texas, and the other half are OSU. So, all right, let's see here. The other kind of questions. Penelope, Dr. Weir, kind of off topic. Ooh, I like off topic. But I had always heard that a marriage had to last 10 consecutive years in order, for instance, to draw a divorced spouse. But you seem to say 10 years total. Clarify. Yep, no, that's not off topic at all. That is 100%. There is no off topic. So yes, a lot of social media people out there keep saying consecutive years, but that's not the case. You can be married to a person for 5 years, get divorced, and then remarry. Obviously has to remarry that same person the following year, the following calendar year. So you can get divorced on January 1st, and then the next year, December 31st, get remarried to that same person, and then be married to them another 5 years or more. And Social Security can add those two times together and get you 10 years. So again, it's Social Security. There's exceptions, exceptions. The policy is over 20,000 pages. So yeah, it's Freddie, thank you, Ed. That's helpful. I love your good advice that you give to your audience. Thanks again. Thank you. I appreciate it. Everybody, please press like, so everybody else in the country, we need to get the information out there as much as possible. I'm not doing this just to pander to get subscriptions. If you subscribe, like, and all that kind of stuff, that tells YouTube to send it out to more people. For those that wait until 70 to get SSA, good for those people. I took mine at 68. I wouldn't do it jump on getting the checks now. I wouldn't to get. I wanted to get a jump on getting the checks now. Yeah. With all of these decisions, the decision I make and the decision Freddie makes and everybody, it's completely different. It's with a Medicare Advantage plan, like for instance, your next door neighbor says, "Oh, I like this company; they're really good." Well, that's good for that person, but your doctors might be different, your prescriptions might be different, your needs might be different. So their plan is not necessarily good for you. And retiring early at 62 is not good for everybody. 65, 67, 68, 70. So it's all 100% an individual decision based on your particular life and needs and projections. So that's why I've done over 300 videos trying to every possible example out there. Let's see here. Julie, I was on disability and turned 65 May 3rd and lost group insurance with my employer. Picked up Plan G and WellCare D. What's better out there for D? This plan is not working. All right, so good on you. Plan G, awesome. Yeah, the prescription drug plans are going to get, again, these are insurance companies, and they're looking for that profit. And some of these companies offer zero premium, 50 cents, $1 Part D prescription drug plans. And one thing you definitely did good, Julie, is you did get a prescription drug plan. So that's good. So whoever, the Medicare insurance agent, you picked or you did it yourself, you did right, because there's a lot of people that get a Medicare supplement plan, and that doesn't come with drugs. So you have to get a separate Part D prescription drug plan. And a lot of people say, well, I don't need drugs, so I'm not going to get it. And then a year, 2 years, 5 years, 10 years down the line, when you sign up for it, it's very restricted when you can sign up, and you're going to be penalized for the rest of your life. So you did a good job there. Awesome, awesome. Yeah, sounds like you got the kind of the low ball, perhaps zero premium ish plan, and you can't change unless you move or something like that until October. So when the new plans come out for 2025 in October, you definitely need to check then. So you get your prescriptions out, and you look at the the prescription drug plan that covers your prescription and then gives you the best price. And it won't start until January 1st. So yeah. Carol, I turned 65 in July also. I was considering going with the Blue Cross Plan G. I don't think Blue Cross uses agents. Yeah, no, yep, I did, sign people up. I'm licensed in all 50 states and stuff like that. But I decided, for me, I'm not signing up anybody personally anymore, because I'm, you know, uh, doing all this other Social Security stuff. And so that's why I decided to go ahead and put together a team that I know will do the right thing. But yeah, Blue Cross Blue Shield, they have agents. And again, it's the same exact price. People say, well, I just won't use an agent. I'll just go directly to the company, Medicare Supplement, Medicare Advantage, and I'll save money. It doesn't save you money at all. Doesn't save you any money. The commission is still going to be paid. It's going to be paid to the agent, or the company is going to keep it themselves. So it's exactly the same thing. And since we're on about agents and stuff like that, you're wondering, okay, is zero premium the only reason why so many people, 51% of people, sign up for Medicare Advantage? No. The other reason is, I've talked about this in other videos, is that Medicare insurance agents get more when they sign you up for Medicare Advantage plans. It seems counterintuitive. Wait a second. If I sign up for a zero premium plan, the Medicare agent gets more than if I sign up for a plan, Medicare supplement that costs, $100 a month or something. Yes, the zero premium plan, there's just so much more money in it for the insurance companies, for everybody, that they want you to sign up for that. So they incentivize the Medicare insurance to push, recommend, whatever the case may be, Medicare Advantage. And that's why you've seen all these crazy commercials and people calling you up. And it's just, I'm tired of the whole industry. So that's why, decided to put my own team together. We don't cold call you. If you don't call us, we're not calling you. I hate the calls. Sweet Bug, can I keep my Blue Cross Blue Shield dental and eye care if I'm paying for it myself and get SSI till I turn 65 in 3 years? Or do I just get the SSI and let it cover me? SSI, yeah, SSI, that's welfare-based money, so it's not dental or anything like that. But yeah, if you got dental, a separate dental plan or something like that, absolutely. Generic, yesterday you said we could increase our PIA anytime by going back to work. Is this also true if you become self-employed? Yeah, yep, same type of thing. If you work, even if you're 80 years old and you're receiving Social Security benefits, then if you work, whether it's wages or self-employment, and self-employment is net income. So if you work and don't make a profit, then obviously no. But it's what you pay into, FICA taxes. Then yeah, it's automatic. And I did a video on this, the 6 ways to increase your Social Security check. So I did that, about a week or 2 weeks ago. So make sure you check that out. But yeah, you number one, you have to pay FICA taxes forever. Even after you start receiving Social Security, you pay for that forever. And Social Security continuously recalculates your benefit amount. So if you're 80 years old and you worked a lot, one of your high 35 years, Social Security automatically recalculates everything and increases your benefit. So Texas Yellow Rose. All right. Yeah, great. Tyler, Texas, possibly, huh? Down there. Dr. Weir, I started collecting Social Security at 63 and my husband at 69. How will my survivor benefits be calculated since I didn't wait until full retirement age? Just curious for future planning. Good job. Good job. Yes. Um, yes, it doesn't matter when you retired. It matters when you start receiving survivor benefits. So if you, so it doesn't say how your age is now, but yeah, if you have a spouse that passes away and you're your full retirement age, then you will receive 100% of what that person was receiving. If that person retired early, then it's going to be reduced. But if your spouse started collecting at their full retirement age or after, you get basically what that check was if you're your full retirement age. So when you retire to get your own benefits doesn't matter. It's when you start receiving survivor benefits. All right. Somebody asked, Medicaid can get your house? Yes. Yes. If Medicaid pays for your nursing home care at the end of your life and you rack up a bill of $100,000, then Medicaid offices throughout the country, in some states, they are very rambunctious about they come running when you pass away and they say, oh, this person has a 200, 300, $4,000 house and they owe us $100,000. So they jump at it and they immediately snatch it. But they can't do that if it's an irrevocable trust. And so again, I'm not a lawyer, don't play one on TV, but reach out to one of your local estate planning attorneys and say, hey, how can I do to protect my house? I want to give it to my kids. And a lot of these states, all of them have a 5-year look back. So you have to do that 5 years before you pass away. If you do it 4 years before, then the state can take it. So you have to do it 5 years prior. The money you pay over the earnings limit, when do you get that money back? Okay, so if your benefits are withheld, $1 for every $2 you go over. So that means you don't get that month. So if you get $1,000 a month and let's say you worked $4,000 over, so $2,000 is going to be held back. So January and February is going to be held back. So you don't get payments for January and February. Once you once you hit your full retirement age, that's when those months are put back. So if you took your Social Security check 30 months in advance, but then you went back to work 10 months later, then your benefits are only going to be reduced by 10 months because you only took 10 checks. But it doesn't happen until you hit your full retirement age. And then they put those 20 months back into your calculation. All right. Let's see here. When me and my husband retire, he is retired Navy. Do we still get TRICARE or do we have to use Medicare? Both. So thank you for your service, sister service. Old Marine Corps, so I had to throw out a Marine Corps. Sister service. Where the Marine Corps is the Marine Corps is a part of the Navy, the men's part. Anyway, had to throw that out there. So make sure you tell him I sold that. He'll get TRICARE if he retires, but TRICARE also requires y'all to get Medicare Part A and Part B. And if you get Part A and Part B and you have TRICARE, then you don't need a Medicare supplement because you have TRICARE. It covers all the rest of it. Some people with TRICARE do get a Medicare Advantage plan. So they can, get a little bit wider options and one of the zero premium plans. And there's also plans, Medicare Advantage plans that pay part of your Part B. So a lot of veterans that use, mostly the VA, they, want options outside of the VA. So they get a Medicare Advantage plan so they can go to a private doctor and stuff like that. But they get a version of a Medicare Advantage. They're called honor plans or patriot plans that pay for part of your Part B. So it's kind of a win-win-win situation. So in that case, I recommend Medicare Advantage plans. If you have Medicare and Medicaid, I definitely recommend Medicare Advantage plans, depending on your area and everything. So there's so much more benefits. Um, let's see. Some company gives her mother $270 a month for groceries. She has Medicare and Medicaid. What is it? Okay, perfect. Yes, that's exactly. Wow, you guys are awesome. That was what I was just talking about. People with Medicare and Medicaid, they're called dual eligible. They're eligible for Medicare and Medicaid, so they have both. So those people that have both are eligible for a Medicare Advantage dual eligible plan. And yeah, so those I recommend, unless because there's so many benefits. I guess her mom gets $270 for a grocery card, and there's dental and vision, so those are great. Um, but if it ever turns out that you need home health care, that you need people to come into your house, some of those plans say they cover it, or actually do cover it. But the problem is I have found that companies that do that home health care, come out and do the laundry for you, and do your kind of in-home health care and all that kind of stuff. A lot of those companies don't like Medicare Advantage plans because they don't pay very much, and they pay late, and they're just annoying. So, and there's enough business out there for people that directly have Medicaid. So just kind of keep that in your head, that if your mother ever needs some type of home health care, you might have a difficult time finding one that takes your particular insurance. So you have to say, okay, $270 a month, or home health care that she needs. Maybe I should just go ahead and give up the $270 because she needs home health care on a regular basis. So yeah, that's just kind of hopefully that doesn't happen, but just in case, yes. But they are out there, and that's one of the things that the government, Medicare, CMS, the Center for Medicare and Medicaid Services, did recently. They're really clamping down. This is awesome. They're really clamping down on the whole Medicare, particularly Medicare Advantage industry, agents and everything. The football players and starship captains and all that kind of stuff. They offer plans like that, like her mother in her area. There's a plan for people with Medicare and Medicaid that gives $270 for groceries. And what they'll do is, up until now, you would have some football player on, or Facebook or something like that. Hey, get your $270 grocery card, and they would advertise that nationwide. And it's only in her area, or limited areas. But you call them up looking for that $270. I did a video on this, and the video thumbnail is ice cream and unicorns. All you can eat ice cream and unicorns. They're offering this. But when you call them up, they say, oh yeah, it's not available in your area. And then they put on the hard sell. Medicare has finally come down. You said you can't do that. And they've also come down. This is actually the Federal Trade Commission has come down and said, you can't cold call people based on, if a person says they want you to call them about a Medicare plan, you can call them. Other than that, yeah, you can't call people. So hopefully this is going to reduce this October. Hopefully you won't receive as many annoying phone calls as you have historically. Hopefully, yeah, it's been a nightmare. So, but there's going to be some rogue agents out there that still cold call you, and based on whatever they buy your number from another company that buys it, and finds it. And so somebody buys your information to be able to contact you because you're turning 65. They call you and you say you're not interested, and that person just paid $30 for your information. So they say that person wants, or that company wants to get their money back. So they sell your information to 35 different agents for $1 each. And then you get a call from 35 different agents. So in the future, they can't do that. If you don't specifically tell them, call me, then they shouldn't be calling you. So, which is what I have. Yeah. So if you don't call me, if you don't email me, I'm not going to call you. So, It's 9 months married for survivor benefits. Yes, that is correct. Yeah, if it's a divorced spouse benefit, you had to be married to the person for 10 months. If it's surviving, 9 months. And just with everything Social Security, it's exceptions the exception. So a terminal, and if the person died in the line of service and military or something like that. But yeah, generally 9 months. Yeah, someone has answered another person's question. You'll get Medicare and TRICARE for life. Yes, that is very correct. Uh, get it back. They recalculate your benefit at fraud to account for missed months. For exactly, that is correct. All right, got a good a team out there, a community out there that helps either each other out. All right, let's see. Got a question here. My brother took his Social Security at 62, and a couple of months later, his wife passed. Can he get his wife's instead of his own? She was 62. Yes, yes. So this is good. I did a few videos on this, but it's worth repeating. Um, if you are going to file for spouse or divorced spouse benefits, you have to start your own benefits first, and then you get the difference up to 50%. In survivor benefits, that's different. You can start collecting your survivor benefits at as early as 60. And at 62, even if your own benefits are higher, you might actually want to wait, because you collect the survivor benefits and you wait on your own, and your own will increase and increase. And then when it increases to the number you like, you jump from survivor benefits to benefits on your own. So yes. So tell your brother, tell him to think about that. It says, even if your benefits are more, if you don't touch yours is going to increase. So when he files, uh, have the claim special at Social Security. It says, okay, if I wait on my own until I'm 67, how much is it going to be? And they'll tell him, and how much am I going to get for survivor benefits? And then he can make an informed decision at that time. All right, we are at over an hour. Um, can my state Medicaid take a vacant lot? Yeah, real estate. Yes, if there's money in there, absolutely. Let's do one or two more questions. Does Medicaid demand upon death repayment for any services paid for the dental, glasses, routine labs, wellness doctor visits? No. It's just wow. I wonder if they're going to do that in the future. But no, I haven't heard of that being done at all. It's more long-term nursing care, hundreds of thousands of dollars. But the other stuff, no, I've never heard of that. If you've commit type of fraud or something like that, you actually had, you know, uh, you're exempt at a house. Before I worked for Social Security, I worked for Department of Social Services doing Medicaid. They exempt a house and one car. So if you have $1 million house and a Ferrari, those are actually exempt. You can get Medicaid, because they're not going to kick you out of your house, and you need a car to go to the doctors. But if it turns out you also had $1 million stashed away in some lockbox somewhere, then yeah, they could very well come after you for after you're passed, and they find out, and they says, okay, well, we paid Medicaid for this person for 10 years, and they had $1 million sitting away. Then yeah, they could possibly do that. So all right, that'll be it for today. I am going to just another excellent show, Dr. Ed. Thank you. Tomorrow, I'm just going to do Q&A the entire time. So there's not going to be a special topic tomorrow. So if you have questions tomorrow, friends or family have questions, make sure you join me tomorrow. And I'm just going to do a Q&A from the get-go. All right, we'll see you all then. Take care. Have an awesome day. Bye-bye.